I'm Dr. John Bennett. I'm a pediatric specialist here at Canyon View Pediatrics. I work in this beautiful office. I trained at Primary Children's Hospital and graduated from that program in 1994, so I've been here about 24 years. I worked really hard at Brigham University to get into medical school so I could receive the highest level of training in pediatrics, and went to Medical College of Wisconsin. I love working in this state-of-the-art office where we have lab, x-ray, ultrasound, everything I need to be able to practice high-quality medicine. I have 6 kids, 3 of them are at home, and we are doing sports all the time when I'm not here. So we go from baseball to golf to tennis to baseball to football to golf to baseball. Did I say baseball? We are just very active doing sports all the time. There's 4 things basically I think about when I see patients. One is something they call the paradox of proper pediatric practice, and that's a mouthful of words, but let me help you understand what it means. It means that sometimes doing the right thing for patients is not really very business savvy, which is actually the way I want to practice medicine. So an example would be a child comes in, 3-year-old, with runny nose, fever of 102 for 4 days, and cough. Child does not look sick, exam is reassuring, but parents might think this is a sinus infection. Some doctors might give an antibiotic for sinusitis, and the child's fever would go away in 2 days. The problem is that would have happened regardless if they had an antibiotic or not. And then the parent might come back in a week and a half because the cough hasn't resolved, and the doctor might give an antibiotic for bronchitis. The cough gets better in a week. The problem is the cough would have gotten better anyways. And then we have to deal with all the complications of antibiotics, like resistant germs, potentially infections, diarrhea, increased chance of Clostridium difficile. My philosophy is to try to do what's necessary to help people to get healthy on their own and to not have to come back and see me, which is really the paradox of business, because most businesses want people to come in, and I want you to be home and to be healthy. My next practice philosophy is I need to correlate all the different complex things that need to be integrated to help understand the entire picture of why a patient might be having problems. And there's often a single process that starts an entire chain of events that lead to dysfunction. So let me give you an example. I saw a child a few months ago that was not feeling well. And when a kid comes in with general complaint, I'm not feeling well, that could be a lot of different things. It could be celiac disease or anemia or thyroid problems or anxiety or depression or sleep problems or social problems or a whole host of other issues, inflammatory bowel disease. As I get into the history with this patient, it turns out that they had stopped playing their sport because somebody told them that they should quit sport because they had knee pain, but never bothered to tell them why they had knee pain. So as I evaluated the patient, it turns out that they had patellofemoral syndrome from abnormal knee mechanics, which were caused by subtalar pronation and flat foot problems. So the issue here was to help the patient resolve those knee mechanic issues, get them back into sport, and get them back on track again. But I have to integrate all of these different things to be able to do that. So in my last 24 years of practice, it seems like things have changed a lot in people's philosophy of how they want healthcare, and a lot of people seem to want it much more like they get their fast food. You pull up, you order your hamburger with double cheese and bacon and your shake and your large fry, and you get to the window and you pay and it's there and you're gone. And that doesn't actually work very well for my practice because of how I integrate all the different things that might cause trouble and help people to stay healthy. So for example, I saw this child a few months ago that came in with ear pain just in the morning. And as I got talking about it, it was just a little unusual presentation. It turns out the child didn't want to go to school, and it was 2 years behind in school and had never really been evaluated for this. The child's ears were fine. The problem is that they had significant school avoidance because of dysfunction. And so we get into these things a little bit, it takes some time. So if you pull up to my fast food window, I might talk to you about how much trans fat and how much sodium and how many calories are in this meal, and what you think about that for your future health. My third philosophy of healthcare, was really important to me, that I'm passionate about, is prevention. So when I see kids for sports physicals, I always talk to them about how to prevent injuries. I look at their biomechanics of the lower extremity and talk about how they might prevent ACL injuries or prevent Little League elbow or other throwing injuries. And these biomechanical things are all connected. So sometimes throwing athletes will have problems with their shoulder or elbow because they have mechanical issues at their ankle or their knee. And it's important for them to understand the entire complexity of this problem so that they can do proper exercises and training to prevent problems. So I've done a nice article on my website that talks about overuse injuries and how to prevent them. Another example is with language, which is one of my passions. So I evaluate kids for language development, and this is one of the great things that my 6 children taught me is how kids should be interacting and thinking at certain ages. So for example, if a 5-year-old comes in and they can't tell me a simple story back, then I need to be concerned that that child may have some language delay. We'll do other testing because language delay will compound over time and may affect future reading ability, future cognitive development. But I will evaluate those things with a preventative sort of outlook when people come in. My 4th practice philosophy is that virtually anything that helps kids function optimally will involve integration of behavioral, social, or interpersonal dynamics. And parents need to understand how to utilize resources and how to help their child with behavior to optimally function. So for example, if you have a throwing athlete, a pitcher for example, they should only be throwing a certain number of pitches in a certain number of time, but you have to be careful of how you interact with the coach so you don't come across as abrasive because your kid may end up sitting on the bench and not throwing at all. If you have a child with a learning problem, you need to know how to interact with the school so you don't diminish potential opportunities. And behavior is also obviously a complicated thing that parents have to deal with, and it's hard to be a good parent. It's a struggle for any of us. So to help kids function, I teach parents how to use the resources, how to help kids with behavior, social interactions, and interpersonal dynamics that they will face in order to help their child optimally function. I hope that helps you understand my practice philosophy. I would love to help you to stay healthy and to know how to take care of problems that you can manage at home. And if there are complexities that are bogging your child down, I've worked really hard to be able to understand all the different facets and help you know how to get them better. And if I can help you, I'd love to be your pediatrician.